Welcome to Planning with Purpose. My name is Raymond Lavine. We have as our guest Dr. Gerda Maissel, who will explain how she advocates for her clients who have health care issues. She calls herself the Medical Sherpa, and we will find out how she advises her clients who have medical issues. Dr. Gerda Maissel is a private patient advocate and founder of MyMD Advisor. She is both a board-certified physician and rehabilitative physician and a board-certified patient advocate. After working as a physician and then as a medical group president, she combined her clinical and business skills to help people with complex medical problems to negotiate and explain medical issues with their patients, clients, doctors, hospitals, and rehabilitation facilities. She translates doctors speak, supports informed decision-making, and helps clients problem solve with physicians and others who will be responsible for their treatment and recovery. So Gerda, you're a medical advocate. Explain to our listeners how you decided to transition from practicing medicine and business executive to advising people with their health issues.
Well, hi, Raymond. So I made the transition after seeing a lot of unhappy families and patients. I saw so many people who were struggling with the medical system. They often became overwhelmed, angry, had bad experiences, and I knew that I was in a position to be able to help them. And during the pandemic, I had been down in Florida, and I decided I really wanted to return to New York, where I grew up and where I have my, at the time, almost 90-year-old mother. And from a personal point of view, this was a business that I could do from my home. And it fit with being able to be near my mom, who was not doing well during the pandemic. And I got to be useful to people. So kind of a little bit of everything.
When is it helpful for people to contact you for your care advocate services to advise them about their health issues?
Well, people generally contact me because they're overwhelmed. Most people actually who contact me are the family. So it could be a spouse worried about their husband or wife who's in the hospital. It could be adult children. Occasionally, especially solo agers will contact me about themselves, but most people contact me or through a recommendation, someone knows me, because they're feeling overwhelmed, unsure, angry, and they want an objective, independent, knowledgeable person to help them get better medical care.
And how do people find you? You said people find you through recommendations. Are these families, friends, physicians, hospitals?
Yes. It's anybody that knows me and then encounters a friend, a colleague, a client who is struggling. I've had people refer to me for themselves. I've had people send me their best friend. I recently had somebody send me their business coach. It's a relationship. And when you care about somebody and you see that they're suffering because they're overwhelmed, and they need help with an ill family member or themselves, if you know about a patient advocate like myself, you say, well, talk to this lady for a little bit and see if perhaps she can help.
Well, in your newsletter, and we'll expand this because I'm sure you have lots of stories, but in the Foglight, you write articles about health issues. What stories do you have to advise people when they are dealing with doctors, administrators, nurses, and other healthcare providers, whether it's a scheduled setting or in an emergency? Tell us some stories of when and why people contact you, and what kind of issues are they having where you can be their medical advocate.
Okay, sure. Well, so let's start with just explaining a little bit about what I do because it can be kind of confusing to people. So there's two fundamental scenarios. One is, let's say you've got a loved one in the hospital. Well, when you got a loved one in the hospital and it's not just a sprained ankle, it's something complicated. What I do is I follow along and I often pick up times where you're receiving conflicting advice. One doctor says, do this, the other doctor says, do that. And I help people ask the right questions to the right doctors to sort out the course of action. Another common problem is a doc may make a recommendation and the doctor's missing the full picture of the patient. They may not have the full past medical history. So to give you an example of that, I had a lady in the hospital who was having some kidney problems, and the nephrologist, a lovely guy, wanted to put in what are called stents. They're tubes that go into the kidneys. Well, when he and I talked, I made sure that he understood that this patient had a neurogenic bladder. And for reasons we don't need to go into now, that changed the course of the treatment. She also had a pelvic tumor, which also potentially caused the course of the treatment. And after we talked and he realized that there were these different pieces going on, he went in a whole different direction. He pulled in a couple different specialists, and ultimately she did not get these stents. Because he was a great guy, but he hadn't realized the full extent of her medical issues. And just through conversation, I was able to, in a non-confrontational way, fill him in and ask a few appropriate questions in doctor language to come across not as, hey, doctor, you don't know what you're doing, because I'm not a nephrologist, but rather, hey, doctor, were you aware of, and if now that you know, does that change your treatment plan? So that's what I do sometimes in the hospital.
Do you actually come to the hospital or do you call them? Because one of the things that, I personally and everybody that I have ever known has difficulty talking to a doctor. This is in the old days where you could talk to Dr. Kildare or Dr. Welby. These days, it's very difficult to actually have a conversation with a doctor. Is it because you're a physician that they will talk to you, or they don't usually talk to the patients on the phone?
Well, so to answer the first part of your question, I work nationally, so I help people all across the country. So sure, if somebody happens to be near me in my location in New York, I'm happy to go in. But the vast majority of the times, there's a family member who's visiting with a sick loved one, and then we wait for the doctor to come in, and then I talk on the phone with the doctor and with the family. And sometimes when there's some more detailed information, like the case that I just mentioned where they were talking about doing a certain procedure, I might call the doctor or have the family ask the doctor to call me. And then we have a doc to doc. But most of the conversations are together with family. And most doctors, once they get to know me, are happy to have me involved. I wasn't sure at first whether they would see me as like, who's this outsider? Because I'm not going in saying you're wrong or here's what you need to do. I'm not there to second guess them. I'm there to condense the information transfer so that what the family wants and needs to know can get said by me in 2 sentences, and it saves the doctor's time. What I can tell them in 2 sentences, because I know what they're thinking and where their decision trees are and where their points are, I can give them in 2 sentences what it might take the family half an hour to tell them. And so they quickly realize, oh, okay, this Dr. Gerda, she's gonna save us some time. And then sometimes when I give them a piece of information that I know is relevant, not extraneous, but relevant, it helps them feel like, oh, okay, good. Now I know this, and we can now, I call it think more deeply, but make a better recommendation. Because every doctor wants to do a good job, but they don't have time to go through the records and pull out every last detail.
There's a book out called Super Communicators by Charles Duhigg, and he has a chapter in there about a doctor that was having problems communicating with his patients. And what I learned from this from that chapter has to do with doctors will give medical information, but what this doctor was frustrated about was it was 2 conversations. One was a medical procedure. Another was, well, how do you feel about it? And it was, let's say somebody has a medical condition where maybe they really don't need the medical procedure, maybe something else. But it's what is the client thinking? What is the patient thinking?
Right. Well, all of that is true, and that's all part of a medical decision. It's a combination of medical information, understanding the medical information, and the person's values, beliefs, and fears and their own emotions. But I'll add something else that I've seen. There is also a huge subtext in what doctors say that very few patients understand. And because I speak doctor, I understand what's being implied. And I have been really surprised. When I started this, I thought I was going to do a lot of medical translation, explaining exactly what medical terms mean. And I find that a lot of what I do is explain the medical subtext. When doctor asked you this is what he was getting after. And because you answered it that way, that's why he or she believes fill in the blank. Because sometimes patients are astonished, like, well, I didn't say that. Why is he thinking this? Or the doctor says, here's what I think you should do. And underneath it, it's like, you can if you want to, honey, but that doesn't really make sense to me. And, there's a lot of implied communication. So a piece of that is after the conversation happens, I draw out for my client what the full version of what was being said so the client can make a fully informed decision.
One last question. Do you advise families, how do you advise family with home care services, or if they have acute care or need an assisted nursing or cognitive care facility? How do you advise your clients where they have a really long-term cognitive or health or accident issue? How do you advise your clients in those areas?
Oh, well, if you wouldn't mind, I'll go back a little bit to finish what we were starting to talk about, which is ways that I help people. And I'd given you an example of how I can help people when they're in the hospital. I also help people in rehabilitation facilities, and I also help people in community. And whether you're in the hospital, rehab, or community, there's often issues, which you just alluded to in your last question, around levels of care. What's the right next place for mom? Can mom stay here? What services are needed? And I advise on all of that. And it's all in the context of what are the medical issues? What are the values? What does the person care about? What do they want to choose? And what's the trajectory of the illness? And then, as part of that, so the medical piece of what I do in the community is often sort of pulling together for the patient and the family, the specialists. They may have multiple specialists, 10 different specialists, not uncommon, none of whom talk to each other, each of whom have been prescribing one drug on top of another on top of another. I got one guy who was on 30 drugs, who's living in the community. It's because doctors are so good at starting medicines, but we're not so good at stopping them. And we only look at the ones in our little world. So it's very common in the community. I do it in the hospital too, but in the community, I'm looking at what are all the different medicines and going through with people. Here are the interactions. Here's the adverse drug events that might happen. Here's the side effects. You taking this drug? Well, you're taking this drug to chase the side effect from that drug. So now instead of being on one drug, you're on 3. And start to peel all of that back. And so to me, it's all part of a big picture. To give you an example of somebody that I helped bring home that you wouldn't even think of, my very first and most wonderful client was a family where they were driving into New York City in a terrible rainstorm. There was a car accident, and his wife became a quadriplegic on a ventilator. And she went through rehab, and he contacted me through mutual friends when she was in a nursing home on a ventilator, and he said, "They're killing my wife." And at first I thought he's just upset. And then I looked into the care, and he was right. And I helped him get her out of that nursing home to someplace to get better care. And then she wanted to go home. Now, bringing a quadriplegic on a ventilator home is not an easy thing, but we did it. And she had many months at home. Now, it took a lot of resources and was absolutely exhausting for the husband. So I'm not saying it was easy to do. But I helped him through all of the things, what the home staffing, what the home modifications, told him he had to get a generator, all of those sorts of things to help his wife have that gift of time at home before she passed.
So was it that specific care center that just didn't have the support system, so it was more efficient to be at home than maybe to look at another care center?
Well, the reality is that when you're on a ventilator, there are limited choices, especially when you're on a chronic ventilator, and they're not always great choices. And she wanted to be home. It wasn't, there's no place like home. And she wanted to be home. Yes, she was in her living room. She didn't, couldn't go upstairs to her bedroom, but she was home in her living room for many months. And, then her family and her friends could see her at home. And that's what she wanted. She valued that above everything else. And so we made it happen for her.
Do you have any other home care stories that you'd like to tell us?
There's so many. I mean, we could talk about so many different things. I had sometimes, and I've been actually, my next newsletter is going to cover this one. Sometimes when doctors make recommendations, they don't always think about the whole person. They don't always think about not only the person's values and desires, because they don't know it, but also the social environment. So this particular person, I had helped her with her husband who has Alzheimer's and had been helping her for a while with her husband. She was living with her husband with Alzheimer's. She was in her early 90s and she needed a hip replacement. So she went in and the doctor said, "Oh, I'm going to send you straight home after a hip replacement." So yes, she's a mobile 91-year-old, but she's living with a husband with mid-stage Alzheimer's. And I said to her, you might want to consider going to a nursing home for a little while and making arrangements for him. And she went back and she talked to the doctor, and the doctor was like, no, go home. There's too many germs in nursing homes. So she said, okay. I said, who are you expecting is going to help you? And she said, oh, they're going to send in the visiting nurse. I'm like, the visiting nurse is going to come once or twice a week. Well, they're going to send aides too. Yep, they'll help you get washed up a couple of times a week. But if you need to go to the bathroom and you can't get there by yourself, your husband's not going to be able to help you. So in the end, she had family come in for a few weeks, and then she had full-time aides with her, living with her for about another 4 to 6 weeks, because she couldn't get out of bed by herself. She couldn't get to the toilet by herself. She, a hip replacement's a significant thing. And while she did eventually recover, the advice of go home and, the visiting nurse will take care of you, if she had tried that, she would have bounced right back to the hospital because she would have failed.
Well, it's good that she had, the resources and you to advise her.
That's right. And if she didn't have the resources, then, at first she didn't think she was going to have to hire. She thought family could do it all. And she thought she'd be back after 2 weeks. But she could have ended up, if she didn't have the resources, she would have needed to have gone to a nursing home for care.
Well, Gerda, thank you for being on this podcast, and I hope you'll return from time to time with advice and stories to help us with understanding and negotiating and advocating for caregiving services. Gerda, how many people subscribe? You have a newsletter, the Foglight, when you publish it, I read it.
Oh, thanks. The Foglight is available through Substack, and if somebody isn't sure what to do, they can email me at Gerda at mymdadvisor.com, and that's really the best way to reach me.
And can I give out your website address, www?
Yeah, same thing, www.mymdadvisor.com.
Well, here's how you can contact Raymond Lavine, 253-275-6091, or go to my website, www.lavineltcins.com. And please subscribe to the Prepared Caregiver. Experience a beautiful day in your neighborhood.